Hello, I'm Dr. Jared Rogers. I serve as Medical Director at Chestnut Health Center in Bloomington, Illinois. I'd like to talk a little bit about ticks. I think we can all agree on a couple of things when it comes to ticks. They're pretty creepy and nobody wants to have a tick on them, particularly biting them. So how do we avoid this? Because none of us want to get those things that ticks can carry, things like Lyme disease or Rocky Mountain spotted fever. So prevention is the key. So if you're going to be out in the woods hiking or exploring, or you're going to be working in some area or playing in some area that has tall grass and weeds, you're at much higher risk to encounter a tick. In Illinois, ticks are all over the place. And so when you're going to be doing these things in high-risk situations, it's important to wear clothing that protects most of your skin. Long sleeves, long-legged pants. Some people even say putting rubber bands around your cuffs of your pants and your sleeves. Maybe you should. But however we can keep ticks off of us is important. So next thing is using some sort of tick repellent. You hear a lot about DEET, D-E-E-T, and that works very well to repel ticks, but some people develop a sensitivity in the skin to that chemical. So you can use other things. You can use oil of lemon eucalyptus, or you can use picaridin, which both repel ticks quite well and aren't as sensitizing to the skin. So let's say you do all those things and you still get a tick on you. Well, if the little guy is just running around on your skin, you're in good shape. Just flick the tick off with your finger, as long as you're outside. If you're inside, you don't want to put him in your home where he can come back and get you. But what you'd like to do is just, pick it up with a Kleenex or a piece of tape. Just Scotch tape, stick that to the tick, then wad it up, throw it away. With the Kleenex, you'd want to drop that in the toilet and flush the tick away. Do not try to squish the ticks. They're really hard to crush. And the other thing that you can do is when you crush the tick, you can release some of the bacteria that the tick is carrying that you really don't want on you or in you. So let's say it's gone beyond that. The tick is not only just running around on your skin, but somehow has affixed itself to your skin and is stuck to you. You want to get that tick off there when you can, as soon as you can, and using some tweezers just to grasp the tick down by the mouth parts right next to the skin, and then gently but firmly pull away from the skin. You don't have to twist, you shouldn't jerk, and hopefully the whole tick will come out. Same thing, drop that tick down the toilet or drop that tick in a plastic bag with a little bit of oil in it, or again, wad up the tick in some tape and throw it in the garbage. So if you leave a few mouth parts behind, you can usually pick those out with the tweezers. But if you can't get them out easily, don't worry about them. Wash it with some good soap and water. If that tick has been there for very long at all, or you think it might be, you should contact your physician or other provider to talk about potential antibiotic therapy that might prevent an infection. Let's say you don't see a tick bite you, but you develop a funny looking spot on your skin that looks like a target with a red rim, and it seems to be getting a little bit bigger as the days go by. That is very likely, or potentially at least, a tick bite, and you should definitely talk with your provider or your physician about treatment for that. So if you can, stay away from the ticks. If you can't, protect yourself, and if they get you, you know what to do.